Are you aware that foodborne diseases can negatively impact your businesses? What are foodborne diseases? These are infectious diseases primarily causing gastrointestinal symptoms such as diarrhea, abdominal pain, and vomiting, resulting from the consumption of water or food contaminated with pathogenic microbes or toxic substances. In Korea, 28 types of foodborne diseases are managed as legally recognized infectious diseases, and some are commonly encountered in daily life. In 2023, restaurants were the most common sites of outbreaks, followed by schools, academies, and daycare centers, with norovirus identified as the most frequent causative pathogen. The main symptoms include diarrhea, abdominal pain, vomiting, fever, and jaundice. And they can easily spread in daily life, so constant vigilance is necessary. Transmission occurs through contaminated groundwater and drinking water, ingestion of contaminated food, and contact with fecal material or vomitus of an infected person or carrier. Infection can also occur through aerosolization of fecal material or vomitus of the patient or carrier. So, how can we block the transmission of foodborne diseases? The best method is hand washing. For cooks, it is essential to wash hands before handling or preparing food, after using the restroom, after every break, and after eating, after touching raw meat, poultry, fish, eggs, or unwashed vegetables, and also after touching a wound, handling or emptying garbage bins, cleaning, touching telephones, light switches, door handles, card terminals, or money, touching body parts like hair or nose, or touching dirty or contaminated surfaces, and also before wearing or changing gloves. What then is the most effective method of hand washing? First, thoroughly wet your hands with running warm water and apply soap to your palms. Rub your palms together to create a lather. Rub the back of each hand with the palm of the other hand with interlaced fingers. Rub your palms together with fingers interlocked. Rotate your thumbs using the palm of the other hand, and rub the tips of your fingers on the palm of your hand. Rinse your hands under clean running water. Dry them thoroughly using a disposable towel or a hand dryer, and then use a disposable towel to turn off the faucet and dispose of it. Proper use of disposable gloves can reduce the risk of infection transmission. However, improper use of disposable gloves can actually increase the risk of transmission. Therefore, hand washing is essential before putting on and when changing gloves. The timing of glove replacement is particularly important. Disposable gloves should be changed when they become dirty or damaged, before switching to a different task, after touching anything else during work, after handling meat or seafood, before handling ready-to-eat food, and most importantly, at least every 4 hours for the same task. Additionally, in a cooking environment, it is advisable for employees showing symptoms of foodborne diseases to not participate in cooking duties. Employees with symptoms of vomiting and diarrhea should be excluded from cooking duties for 48 hours after symptoms disappear. For jaundice, it is recommended to exclude them for 7 days after symptoms appear. If there is a skin infection or injury, exclusion from cooking duties is not necessary if the affected area is effectively covered. Switching to non-food handling duties like cashier tasks or organizing packaged foods is also a solution. Employees diagnosed with or showing symptoms of foodborne diseases should inform their manager. Managers should exclude food handlers who show symptoms of foodborne diseases from food handling tasks and areas. Additionally, for preventing infections in cooking environments, intensive cleaning, and the use of automated doors, touchless toilets, and touchless faucets are effective infection prevention methods. Understanding the symptoms of foodborne diseases and taking appropriate measures can reduce the risk of infectious disease transmission. This campaign is conducted in partnership with the Seoul Infectious Disease Research Center.